Question 1. The monitoring system demonstrates that a client is concurrently using St. John's wort, a commonly known herbal supplement, alongside a prescribed antidepressant medication. As a holistic health practitioner, HHP, certified under the relevant U.S. regulatory framework, what is the most appropriate immediate course of action to ensure client safety and professional compliance? Option A. Continue with the HHP's recommended herbal protocol for the client without any further inquiry into the pharmaceutical use. Option B. Immediately advise the client to cease taking the St. John's wort and consult their prescribing physician about potential interactions. Option C. Recommend a higher dosage of St. John's wort to enhance the antidepressant effect, assuming it will be beneficial. Option D. Inform the client that St. John's wort is a natural remedy and therefore poses no risk when combined with pharmaceuticals. The correct answer is B. Immediately advise the client to cease taking the St. John's wort and consult their prescribing physician about potential interactions. Explanation. This scenario is professionally challenging because it requires the holistic health practitioner, HHP, to navigate the complex and potentially dangerous intersection of herbal remedies and pharmaceutical medications. The HHP must possess a thorough understanding of both domains, recognizing that seemingly benign natural products can have significant physiological effects, including interactions with prescription drugs. This necessitates a proactive and diligent approach to client care, prioritizing safety and informed decision-making above all else. The correct approach represents best professional practice because it prioritizes client safety and adherence to regulatory guidelines for HHPs. By immediately consulting with the client's prescribing physician, the HHP demonstrates a commitment to collaborative care and acknowledges the limitations of their scope of practice when it comes to pharmaceutical interventions. This aligns with ethical principles of non-maleficence, do no harm, and beneficence, act in the client's best interest. Furthermore, it upholds the HHP's responsibility to operate within their defined professional boundaries, which typically do not include prescribing or altering pharmaceutical regimens. This proactive communication ensures that any potential herb-drug interactions are managed by the medical professional best equipped to assess the risks and benefits to the client's overall health. An incorrect approach that involves advising the client to discontinue their prescribed medication without consulting the physician represents a significant regulatory and ethical failure. This action directly interferes with a client's established medical treatment plan and could lead to serious adverse health consequences, including withdrawal symptoms, exacerbation of the underlying condition, or treatment failure. This violates the HHP's duty of care and potentially constitutes the unauthorized practice of medicine. Another incorrect approach, such as recommending a high dose of the herb to counteract the medication, is equally dangerous and ethically unsound. This demonstrates a lack of understanding of herb-drug interactions and a reckless disregard for client safety, potentially leading to synergistic toxicity or unpredictable physiological responses. Finally, ignoring the potential interaction and continuing with the herbal recommendation without any further investigation or consultation is a failure to exercise due diligence and a breach of professional responsibility, leaving the client vulnerable to harm. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the potential risk. Recognize that any client taking pharmaceuticals who is also using herbal supplements is at potential risk for herb-drug interactions. 2. Gather information. Obtain a comprehensive list of all medications, prescription and over-the-counter, and all herbal supplements the client is taking. 3. Assess the interaction risk. Utilize reliable resources to research potential interactions between the specific herbs and pharmaceuticals identified. 4. Prioritize safety. If a significant interaction is suspected or confirmed, the client's safety is paramount. 5. Consult with the prescribing physician. This is the critical step when pharmaceutical interventions are involved. The HHP should communicate their concerns and findings to the physician, who is ultimately responsible for the client's medical management. 6. Educate the client. Provide the client with clear, understandable information about the potential risks and the steps being taken to ensure their safety. 7. Document all actions. Maintain thorough records of all communications, assessments, and recommendations. Question 2. Stakeholder feedback indicates a persistent feeling of being overwhelmed, leading to frequent headaches and digestive upset. As a holistic health practitioner, how should you approach assessing the potential impact of stress on this individual's body systems? Option A. Focus solely on the reported headaches and digestive upset, recommending over-the-counter pain relievers and dietary changes without further exploration of the stress component or other bodily systems. Option B. Conduct a comprehensive assessment that includes exploring the nature and duration of the perceived stress, identifying specific triggers, evaluating the individual's coping mechanisms, and inquiring about other physical symptoms and lifestyle factors, while cross-referencing reported symptoms with known physiological responses to chronic stress. Option C. Immediately recommend a high-dose herbal supplement known for its calming properties, as the feedback clearly points to a stress-related issue affecting the digestive and nervous systems. Option D. Advise the stakeholder that stress is a subjective experience and that their symptoms are likely psychosomatic, suggesting they focus on positive thinking to alleviate their physical discomfort. Correct answer is B. Conduct a comprehensive assessment that includes exploring the nature and duration of the perceived stress, identifying specific triggers, evaluating the individual's coping mechanisms, and inquiring about other physical symptoms and lifestyle factors, while cross-referencing reported symptoms with known physiological responses to chronic stress. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a holistic health practitioner, HHP, to interpret and act upon subjective stakeholder feedback regarding the impact of stress on body systems. HHPs must balance client-reported experiences with their knowledge of physiological responses to stress, ensuring their interventions are evidence-informed and ethically sound, without overstepping professional boundaries or making unsubstantiated claims. The challenge lies in translating qualitative feedback into actionable, appropriate health guidance. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates the stakeholder's subjective experience with objective physiological indicators and established scientific understanding of stress's impact. This aligns with the HHP's scope of practice, which emphasizes a holistic view of well-being. By considering multiple facets of the individual's health, including their reported stress levels, physical symptoms, and lifestyle factors, the HHP can develop a personalized and effective plan. This approach respects the client's lived experience while grounding interventions in evidence-based principles of stress management and its physiological effects, adhering to ethical guidelines that prioritize client well-being and informed decision-making. Incorrect approaches analysis. One incorrect approach involves solely relying on the stakeholder's self-reported symptoms without further investigation or consideration of other contributing factors. This fails to meet the professional standard of care by potentially leading to misdiagnosis or inappropriate recommendations, neglecting the complex interplay of factors influencing health. It also risks oversimplifying the impact of stress and may not address underlying physiological mechanisms effectively. Another incorrect approach is to dismiss the stakeholder's feedback as purely subjective and focus only on objective, measurable physiological data, ignoring the client's lived experience. This disregards the crucial role of the client's perception and emotional state in their overall health and well-being, which is central to holistic practice. It can lead to a disconnect between the practitioner and the client, hindering trust and adherence to recommendations. A further incorrect approach is to immediately recommend a specific, unproven or experimental intervention based solely on the feedback, without a thorough assessment or consideration of the scientific literature on stress and its effects. This poses a significant ethical risk, potentially exposing the stakeholder to ineffective or even harmful treatments and violating principles of evidence-based practice and informed consent. Professional reasoning. Professionals should employ a systematic approach that begins with active listening and empathetic validation of the stakeholder's concerns. This is followed by a thorough assessment that gathers both subjective and objective information, considering the individual's history, current lifestyle, and specific symptoms. The practitioner then synthesizes this information using their knowledge base of stress physiology and holistic health principles to identify potential impacts on various body systems. Finally, they collaboratively develop a personalized, evidence-informed plan that may include lifestyle modifications, stress reduction techniques, and, if necessary, referral to other healthcare professionals, always prioritizing safety, efficacy, and client autonomy. Question 3. Process analysis reveals that a client diagnosed with stage Roman III breast cancer is undergoing chemotherapy and radiation. They are seeking an HHP's guidance to complement their conventional treatment and manage side effects. The client expresses interest in a specific adaptogenic herb known for its immune-modulating properties and asks for a high-dose recommendation. The client also mentions a strong preference for natural therapies and expresses some skepticism about the necessity of their current medical interventions. Which of the following approaches best aligns with the HHP's professional responsibilities and ethical obligations in this complex integrative health scenario? Option A. Conduct a thorough assessment of the client's current medical status, treatment plan, and potential interactions. Collaborate with the client's oncologist to discuss the proposed adaptogenic herb, its dosage, and potential impact on chemotherapy, while also exploring other evidence-informed integrative modalities that support symptom management and well-being, ensuring the client understands the role of each therapy. Option B. Immediately recommend a high dose of the adaptogenic herb as requested by the client, emphasizing its natural immune-boosting properties and suggesting it as a primary strategy to combat cancer, while downplaying the importance of chemotherapy. Option C. Provide a general list of popular integrative therapies for cancer patients, including the requested adaptogenic herb, without inquiring about the client's specific medical treatments or consulting with their oncologist, assuming all natural remedies are universally beneficial. Option D. Advise the client to discontinue chemotherapy and radiation, stating that a purely holistic approach using energy healing and specific dietary changes will be more effective in eradicating the cancer. The correct answer is A. Conduct a thorough assessment of the client's current medical status, treatment plan, and potential interactions. Collaborate with the client's oncologist to discuss the proposed adaptogenic herb, its dosage, and potential impact on chemotherapy, while also exploring other evidence-informed integrative modalities that support symptom management and well-being, ensuring the client understands the role of each therapy. Explanation. This scenario presents a professional challenge for a holistic health practitioner, HHP, due to the inherent complexity of integrating diverse therapeutic modalities while adhering to scope of practice and client safety. The HHP must navigate the potential for overlapping or conflicting advice, ensure that recommendations are evidence-informed where possible, and maintain clear communication with the client and their conventional healthcare providers. The core of the challenge lies in balancing the client's desire for holistic care with the HHP's ethical and regulatory obligations. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment and a collaborative, integrated care plan. This involves understanding the client's full health picture, including their conventional medical treatments, and then thoughtfully incorporating complementary and alternative modalities in a way that supports, rather than undermines, their existing care. This approach aligns with the ethical principles of beneficence, acting in the client's best interest and non-maleficence, avoiding harm, by ensuring that integrative strategies are safe, appropriate, and communicated effectively. It also respects the client's autonomy by involving them in the decision-making process. Furthermore, it upholds professional standards by acknowledging the importance of interdisciplinary communication and respecting the roles of other healthcare professionals. An incorrect approach that involves unilaterally recommending a high-dose herbal supplement without consulting the client's oncologist or considering potential interactions with chemotherapy represents a significant regulatory and ethical failure. This violates the principle of non-maleficence by potentially causing harm through adverse drug-herb interactions, which could compromise the efficacy of the chemotherapy or lead to dangerous side effects. It also demonstrates a failure to respect the client's conventional medical treatment plan and a lack of appropriate professional collaboration. Another incorrect approach, such as dismissing the client's conventional medical treatment in favor of solely relying on energy healing modalities, is also a serious ethical and regulatory breach. This disregards the established medical diagnosis and treatment plan, potentially leading to a delay or cessation of life-saving conventional therapies. It also oversteps the HHP's scope of practice by making unsubstantiated claims about the superiority of alternative modalities over evidence-based medical interventions. A third incorrect approach, which is to provide a generic list of popular integrative therapies without a personalized assessment, fails to meet the standard of individualized care. This approach neglects the unique needs, health status, and potential contraindications of the client, increasing the risk of ineffectiveness or harm. It demonstrates a lack of due diligence and a failure to apply professional judgment in tailoring recommendations to the specific client. The professional decision-making process for similar situations should involve a thorough intake and assessment that includes understanding the client's current medical diagnoses, treatments, and any other healthcare providers involved. The HHP should then critically evaluate potential integrative approaches, considering their safety, efficacy, and compatibility with the client's existing care. Open and honest communication with the client about the rationale, potential benefits, risks, and limitations of each recommendation is paramount. When conventional medical treatments are involved, collaboration and consultation with the client's primary physician or specialist are essential to ensure a coordinated and safe approach to care. Question 4. Investigation of a client presenting with persistent fatigue, intermittent headaches, and a recent onset of digestive discomfort. The HHP must conduct a risk assessment to determine the most probable underlying cause. Which of the following approaches best facilitates an accurate risk assessment by systematically considering the interconnectedness of major body systems? Option A. Recommending a cardiovascular stress test as the primary diagnostic step, given that fatigue can sometimes be a symptom of cardiac issues, and only then considering other body systems if the stress test results are inconclusive. Option B. Conducting a comprehensive system-by-system evaluation, beginning with the digestive system due to the reported discomfort, then proceeding to assess the nervous, endocrine, immune, cardiovascular, and respiratory systems to identify potential interrelationships and contributing factors to the client's overall presentation. Option C. Prioritizing an in-depth analysis of the nervous system due to the reported headaches and fatigue, while deferring detailed investigation of other systems unless symptoms directly related to them become prominent. Option D. Immediately focusing on the immune system, assuming the fatigue and headaches are indicative of a systemic inflammatory response, and recommending broad immune-modulating supplements without further investigation into other bodily functions. Correct answer is C. Prioritizing an in-depth analysis of the nervous system due to the reported headaches and fatigue, while deferring detailed investigation of other systems unless symptoms directly related to them become prominent. Explanation. This scenario presents a professional challenge due to the interconnectedness of major body systems and the potential for a seemingly minor issue in one system to have significant repercussions in others. Holistic health practitioner, HHP, must exercise careful judgment to identify the root cause of a client's symptoms and avoid misdiagnosis or ineffective treatment. The risk assessment requires understanding how disruptions in one system can manifest as symptoms in another, demanding a comprehensive and integrated approach. The correct approach represents best professional practice because it prioritizes a thorough, system-by-system investigation that considers the client's holistic presentation. This aligns with the ethical obligation of an HHP to provide competent and safe care by gathering sufficient information before formulating a treatment plan. It also implicitly adheres to the principle of do no harm by avoiding premature conclusions or interventions that could exacerbate the client's condition. Regulatory frameworks for HHPs typically emphasize evidence-based practice and client safety, which are best served by a systematic and analytical risk assessment. An incorrect approach that focuses solely on the most obvious symptom without exploring underlying systemic connections would be a regulatory and ethical failure. This could lead to treating the symptom rather than the cause, resulting in a lack of improvement or even worsening of the client's health. It demonstrates a lack of due diligence and a failure to meet the standard of care expected of a certified HHP. Another incorrect approach, such as immediately recommending aggressive interventions based on limited information, poses a direct risk to the client's well-being and violates the ethical principle of informed consent and prudent practice. This bypasses the necessary risk assessment and could lead to adverse outcomes, contravening regulatory requirements for safe and effective practice. The professional decision-making process for similar situations should involve a structured approach. First, actively listen to and document the client's presenting complaints and history. Second, conduct a comprehensive assessment, systematically evaluating each major body system, nervous, endocrine, immune, digestive, cardiovascular, respiratory, for potential contributing factors. Third, Identify potential interdependencies between systems based on the gathered information. Fourth, formulate a differential diagnosis, considering the most likely causes of the symptoms. Fifth, develop a targeted risk assessment for each potential diagnosis, evaluating the likelihood and severity of potential complications. Finally, create a treatment plan that addresses the identified root causes and risks, with clear communication and consent from the client. Question 5. What factors determine the most appropriate herb preparation method, teas, tinctures, capsules, for a client seeking holistic health support? Option A. The perceived popularity and widespread availability of a particular herbal preparation method in the market. Option B. The practitioner's personal preference for preparing certain herbal forms and their familiarity with specific extraction techniques. Option C. The solubility of the herb's active constituents, the desired speed of therapeutic action, and the client's individual physiological characteristics and lifestyle. Option D. The overall cost-effectiveness of producing a specific herbal preparation, regardless of its therapeutic suitability. The correct answer is C. The solubility of the herb's active constituents, the desired speed of therapeutic action, and the client's individual physiological characteristics and lifestyle. Explanation. This scenario is professionally challenging because the choice of herb preparation method directly impacts the bioavailability, efficacy, and safety of the herbal remedy, requiring the holistic health practitioner, HHP, to apply their knowledge of both herbal constituents and client-specific factors. Careful judgment is required to select the most appropriate method for optimal therapeutic outcomes while adhering to professional standards and client well-being. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the client's condition, the specific herb's properties, and the desired therapeutic outcome. This aligns with the HHP's ethical obligation to provide individualized care and ensure the safe and effective use of herbal preparations. Regulatory frameworks for HHPs emphasize evidence-based practice and client-centered care, necessitating a tailored approach rather than a one-size-fits-all solution. Understanding the solubility of active compounds, the desired speed of action, and the client's ability to metabolize and absorb the preparation are crucial for maximizing therapeutic benefit and minimizing potential adverse effects. An incorrect approach that solely focuses on the ease of preparation for the practitioner fails to meet the professional standard of care. This overlooks the primary responsibility to the client's health and well-being, potentially leading to ineffective treatment or adverse reactions. Ethically, this demonstrates a lack of diligence and a disregard for the principles of client-centered practice. Another incorrect approach that exclusively considers the perceived popularity of a particular preparation method, without regard for its suitability for the specific herb or client, is also professionally unacceptable. This can lead to suboptimal therapeutic results and may not align with the scientific understanding of how different preparation methods extract and deliver active compounds. It fails to demonstrate the critical thinking and evidence-informed decision-making expected of a certified HHP. A further incorrect approach that prioritizes cost-effectiveness above all else, without considering efficacy or safety, is ethically flawed. While cost is a practical consideration, it should not supersede the client's health needs. This approach could lead to the selection of a preparation method that is less effective or even harmful, violating the HHP's duty of care. The professional decision-making process for similar situations should involve a systematic evaluation. 1. Identify the target condition and desired therapeutic outcome. 2. Research the specific herb, including its active constituents and their properties, e.g., water-soluble vs. alcohol-soluble compounds. 3. Consider the client's individual factors: age, health status, existing conditions, medications, allergies, and ability to adhere to a regimen. 4. Evaluate the different preparation methods, teas, tinctures, capsules, in relation to the herb's properties and the client's needs, considering factors like extraction efficiency, bioavailability, onset of action, and ease of use. 5. Select the preparation method that offers the best balance of efficacy, safety, and client compliance in consultation with the client. 6. Document the rationale for the chosen preparation method. Question 6. When evaluating a client's request to use a specific herbal supplement for a chronic condition, based on information they found online and a friend's positive experience, what is the most appropriate initial step for a holistic health practitioner? Option A. Conduct a thorough assessment of the client's overall health, current medications, and any known allergies or sensitivities. Then research the scientific evidence for the herb's efficacy and safety in relation to the client's specific condition and health profile. Option B. Advise the client that herbal supplements are not scientifically proven and suggest they focus solely on conventional medical treatments for their condition. Option C. Immediately recommend the herbal supplement, assuring the client that since their friend had a positive experience, it is likely to be beneficial for them as well. Option D. Provide the client with a list of online retailers where they can purchase the herbal supplement, encouraging them to start with a low dose. The correct answer is A. Conduct a thorough assessment of the client's overall health, current medications, and any known allergies or sensitivities, and then research the scientific evidence for the herb's efficacy and safety in relation to the client's specific condition and health profile. Explanation. This scenario presents a common challenge for holistic health practitioners, HHP, when introducing herbal medicine to a client. The professional challenge lies in balancing the client's expressed interest and perceived benefits of a specific herb with the HHP's responsibility to provide safe, evidence-informed, and ethically sound guidance. It requires careful judgment to avoid making unsubstantiated claims while still respecting the client's autonomy and the potential therapeutic value of herbs. The correct approach represents best professional practice because it prioritizes client safety and informed consent, aligning with the core principles of holistic health and the ethical guidelines expected of HHPs. This approach involves a thorough assessment of the client's individual health status, potential contraindications, and interactions with existing medications. It also emphasizes the importance of evidence-based practice, encouraging the client to understand the scientific literature and potential risks and benefits, rather than relying solely on anecdotal evidence or marketing claims. This aligns with the regulatory framework that expects HHPs to operate within their scope of practice and to provide guidance that is both beneficial and harmless. An incorrect approach that relies solely on anecdotal evidence or personal testimonials fails to meet the standard of care. This is a regulatory and ethical failure because it bypasses the crucial step of assessing individual suitability and potential risks, potentially leading to adverse effects or ineffective treatment. It also fails to uphold the principle of informed consent, as the client is not being provided with a balanced view of the evidence. Another incorrect approach that involves making definitive claims about the herb's efficacy without robust scientific backing is a direct violation of ethical advertising and professional conduct guidelines. HHPs are expected to be truthful and avoid making unsubstantiated claims, which can mislead clients and erode trust in the profession. This can also have legal ramifications if it leads to harm. The professional reasoning process for similar situations should involve a systematic approach. 1. Client assessment. Thoroughly understand the client's health history, current conditions, medications, and lifestyle. 2. Evidence review. Research the specific herb, focusing on peer-reviewed scientific literature regarding its efficacy, safety, contraindications, and potential interactions. 3. Risk-benefit analysis. Objectively evaluate the potential benefits against the known risks for the individual client. 4. Informed discussion. Engage in an open and honest conversation with the client, presenting the evidence, potential risks, and benefits in a clear and understandable manner. Empower the client to make an informed decision. 5. Scope of practice. Ensure that the recommendations fall within the HHP's scope of practice and do not constitute medical diagnosis or treatment that should be managed by a licensed physician. 6. Documentation. Maintain detailed records of the assessment, discussion, and recommendations. Question 7. The efficiency study reveals that practitioners who extensively reference ancient philosophical texts on interconnectedness and vital life forces in their client consultations tend to report higher client satisfaction scores. But the study does not differentiate between the efficacy of these historical concepts and modern psychosomatic explanations. Considering the regulatory framework for holistic health practitioner, HHP certification, which of the following interpretations of these findings best reflects a responsible and compliant approach to integrating historical perspectives into practice? Option A. Acknowledge the historical significance of these concepts in shaping holistic philosophy, but emphasize that current practice must be grounded in evidence-based modalities and within the defined scope of HHP practice, ensuring client safety and efficacy. Option B. Prioritize the historical philosophical concepts that correlate with client satisfaction, assuming that their long-standing presence implies their continued relevance and efficacy in modern holistic health practice. Option C. Fully embrace the ancient philosophical texts as the primary basis for client consultations, as higher client satisfaction indicates their inherent effectiveness and alignment with holistic principles. Option D. Disregard the historical texts entirely, focusing solely on contemporary scientific research to ensure all practices are demonstrably evidence-based and avoid any potential for misinterpretation by clients. The correct answer is A. Acknowledge the historical significance of these concepts in shaping holistic philosophy, but emphasize that current practice must be grounded in evidence-based modalities and within the defined scope of HHP practice, ensuring client safety and efficacy. Explanation. Scenario analysis. This scenario presents a professional challenge by requiring the holistic health practitioner, HHP, to critically evaluate historical approaches to holistic health within the context of current regulatory expectations for certification. The challenge lies in discerning which historical perspectives align with or diverge from the foundational principles and ethical guidelines that underpin the HHP certification, particularly concerning client safety, efficacy of practice, and scope of practice as defined by the relevant regulatory framework. Careful judgment is required to avoid misinterpreting historical practices as current best practices or overlooking the evolution of ethical standards and scientific understanding. Correct approach analysis. The correct approach represents best professional practice because it demonstrates an understanding of how historical philosophical underpinnings of holistic health have informed and continue to influence contemporary HHP practice. It acknowledges that while historical perspectives may have lacked rigorous scientific validation by today's standards, they laid the groundwork for a client-centered, mind-body-spirit approach. This approach is ethically sound as it respects the evolution of the field, while prioritizing current evidence-based practices and regulatory compliance, ensuring that historical context does not supersede the imperative for safe and effective client care, as mandated by the HHP certification framework. Incorrect approaches analysis. One incorrect approach fails by uncritically adopting historical practices without considering their scientific validity or ethical implications in the current regulatory landscape. This could lead to the promotion of interventions that are not evidence-based or may even be harmful, violating the HHP's duty of care and potentially contravening regulations regarding scope of practice and client safety. Another incorrect approach errs by dismissing all historical perspectives as irrelevant or outdated. This overlooks the foundational philosophical contributions that have shaped holistic health and may lead to a practice that is disconnected from its roots, potentially missing valuable insights into client well-being that, when appropriately integrated, can enhance current practice. Such an approach might also fail to appreciate the ethical evolution of the profession, which is often informed by historical lessons learned. A further incorrect approach might focus solely on the most scientifically validated historical practices without acknowledging the broader philosophical and spiritual dimensions that are integral to a holistic model. This narrow focus could lead to a practice that is technically compliant, but lacks the comprehensive, client-centered ethos that defines holistic health, potentially failing to meet the spirit of the HHP certification. Professional reasoning. Professionals should approach historical perspectives by first understanding the specific regulatory framework governing their certification. They should then critically analyze historical approaches, evaluating their alignment with current ethical codes, scope of practice, and evidence-based principles. The decision-making process involves integrating historical context with contemporary knowledge to inform practice, always prioritizing client safety, informed consent, and adherence to all applicable laws and guidelines. This involves a continuous process of learning and adaptation, ensuring that historical understanding enhances, rather than compromises, professional practice. Question 8. Benchmark analysis indicates that a client presents with subjective reports of heightened anxiety, a resting heart rate of 95 beats per minute, and a blood pressure reading of 145/90 mmHg during a session. The client denies any known pre-existing cardiovascular conditions. The HHP is tasked with determining the most appropriate initial response within their scope of practice. Option A. Recommend specific stress reduction techniques that encourage parasympathetic nervous system activation, such as guided deep breathing exercises and mindfulness practices, to help regulate the client's physiological responses. Option B. Reassure the client that these readings are likely temporary and not a cause for concern, advising them to simply relax and ignore the physiological data. Option C. Suggest the client begin a regimen of specific herbal supplements known for their blood pressure-lowering effects, as outlined in popular wellness literature. Option D. Advise the client to immediately consult a cardiologist for a thorough cardiovascular examination and diagnosis of potential hypertension. The correct answer is A. Recommend specific stress reduction techniques that encourage parasympathetic nervous system activation, such as guided deep breathing exercises and mindfulness practices, to help regulate the client's physiological responses. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the holistic health practitioner, HHP, to interpret complex physiological data and relate it to a client's subjective experience, while also navigating the ethical boundaries of their scope of practice. The HHP must avoid making definitive medical diagnoses or prescribing treatments outside their certification, focusing instead on supporting the client's overall well-being through holistic principles. Correct approach analysis. The correct approach involves recognizing that the elevated heart rate and blood pressure, coupled with the client's reported anxiety, are indicators of the body's sympathetic nervous system activation. HHP's role is to understand how stress impacts physiological functions. By suggesting stress management techniques that promote parasympathetic nervous system activity, such as deep breathing exercises and mindfulness, the HHP is acting within their scope to support the client's physiological balance and reduce the impact of stress on their body systems. This aligns with the HHP certifications, focus on promoting health and well-being through non-medical interventions. Incorrect approach is analysis. One incorrect approach would be to interpret the elevated readings as a definitive sign of a specific cardiovascular disease and recommend immediate medical intervention without further assessment of other contributing factors or consultation with a physician. This oversteps the HHP's scope of practice, which does not include medical diagnosis or treatment planning for specific diseases. Another incorrect approach would be to dismiss the client's symptoms and physiological readings entirely, attributing them solely to psychological factors without acknowledging the interconnectedness of mind and body. This fails to address the client's holistic needs and ignores the physiological manifestations of stress. A further incorrect approach would be to recommend specific dietary supplements or herbal remedies to directly lower blood pressure or heart rate without understanding the client's full medical history, potential contraindications, or interactions with any existing medications. This constitutes practicing outside the HHP's defined scope and could pose health risks to the client. Professional reasoning. Professionals should approach such situations by first gathering comprehensive information, including subjective reports and objective data, if available and within scope. They must then analyze this information through the lens of their training and certification, identifying potential areas of support that align with holistic health principles. Crucially, they must recognize the limitations of their scope and know when to refer clients to qualified medical professionals for diagnosis and treatment of medical conditions. The decision-making process involves prioritizing client safety, adhering to ethical guidelines, and maintaining professional boundaries. Question 9. Market research demonstrates a growing interest among consumers in holistic approaches to health, including dietary practices. A client presents to a certified holistic health practitioner, HHP, stating they have been diagnosed with type 2 diabetes and are seeking dietary advice to manage their blood sugar levels and improve their overall well-being. The client expresses a desire for natural and plant-based dietary strategies. The HHP has a foundational understanding of nutrition and general wellness principles. Considering the HHP's scope of practice and the client's diagnosed medical condition, which of the following actions best represents professional and ethical conduct? Option A. Advise the client that as an HHP, they cannot provide specific dietary advice for medical conditions and suggest the client research dietary options online. Option B. Offer general healthy eating guidelines, focusing on whole foods and hydration, without directly addressing the client's diagnosed condition or specific dietary requests related to it. Option C. Provide the client with a general plant-based meal plan and recommend specific herbal supplements known for their potential blood sugar lowering properties, while advising them to monitor their blood sugar. Option D. Acknowledge the client's interest in natural approaches and refer them to a registered dietitian or a physician specializing in endocrinology for medical nutrition therapy and management of their type 2 diabetes. The correct answer is C. Provide the client with a general plant-based meal plan and recommend specific herbal supplements known for their potential blood sugar lowering properties, while advising them to monitor their blood sugar. Explanation. This scenario presents a professional challenge because the holistic health practitioner, HHP, is asked to provide specific dietary recommendations for a client with a complex medical history and a diagnosed condition. While HHPs are trained in nutrition, their scope of practice is distinct from that of a registered dietitian or medical doctor, especially when dealing with specific medical conditions. The HHP must navigate the ethical and regulatory boundaries of their certification to avoid practicing outside their scope, which could lead to harm to the client and professional repercussions. The correct approach involves recognizing the limitations of the HHP's scope of practice and prioritizing client safety and appropriate care. This means referring the client to a qualified healthcare professional who can provide medical nutrition therapy tailored to their specific condition. This aligns with the ethical principle of do no harm and the regulatory framework that defines the HHP's role as complementary to, rather than a replacement for, conventional medical care. It also upholds the professional standard of practicing within one's expertise. An incorrect approach would be to provide specific dietary plans or supplement recommendations without proper medical oversight or referral. This could lead to adverse health outcomes for the client, especially given their diagnosed condition. Regulatory failures in this instance would include practicing beyond the scope of the HHP certification, potentially violating consumer protection laws and professional conduct guidelines. Ethically, it represents a failure to act in the client's best interest by not ensuring they receive appropriate, evidence-based medical advice for their condition. Another incorrect approach would be to dismiss the client's condition entirely, failing to acknowledge the need for specialized medical attention. This demonstrates a lack of professional responsibility and an inability to recognize when a client's needs exceed the HHP's expertise. The professional decision-making process for similar situations should involve a clear understanding of the HHP's scope of practice as defined by their certification and relevant regulations. When faced with a client presenting with a diagnosed medical condition or complex health needs, the HHP should first assess if the request falls within their purview. If the request involves medical diagnosis, treatment, or specific nutritional therapy for a medical condition, the professional decision is to refer the client to an appropriate licensed healthcare provider, such as a physician or registered dietitian. Documentation of the referral and the rationale behind it is crucial for professional accountability. Question 10. Governance review demonstrates that a holistic health practitioner, HHP, is consulting with a client diagnosed with a serious chronic illness who is undergoing conventional medical treatment. The client expresses a strong desire to incorporate specific holistic therapies alongside their prescribed medication and treatment plan. The HHP must determine the most appropriate course of action. Option A. Advise the client to discontinue their conventional medical treatment in favor of exclusively holistic therapies, citing the potential for holistic approaches to address the root cause of the illness. Option B. Focus solely on the holistic aspects of the client's well-being, ignoring any information or recommendations provided by their conventional medical doctor, as the HHP scope is limited to holistic practices. Option C. Recommend holistic therapies that are known to be complementary to conventional treatments and do not pose a risk of interference, while encouraging open communication between the client and their conventional medical provider. Option D. Endorse a wide range of unverified holistic modalities without inquiring about the client's current conventional medical regimen, assuming all holistic practices are inherently beneficial. The correct answer is C. Recommend holistic therapies that are known to be complementary to conventional treatments and do not pose a risk of interference, while encouraging open communication between the client and their conventional medical provider. Explanation. Scenario analysis. This scenario presents a professional challenge where a holistic health practitioner, HHP, must navigate the integration of conventional medical advice with holistic modalities. The challenge lies in respecting the client's autonomy and their right to seek diverse health approaches, while ensuring that the holistic recommendations do not contradict or undermine essential conventional medical treatment, particularly when dealing with serious health conditions. Careful judgment is required to balance support for the client's holistic choices with the imperative to avoid harm and uphold professional standards. Correct approach analysis. The correct approach represents best professional practice because it prioritizes client well-being and safety by ensuring that holistic recommendations are complementary and do not interfere with prescribed conventional medical treatment. This aligns with the ethical principle of do no harm and the regulatory expectation that HHPs operate within their scope of practice, which often includes collaborating with or at least not obstructing conventional medical care. It demonstrates respect for the client's overall health journey while maintaining professional responsibility. Incorrect approaches analysis. An approach that dismisses or belittles conventional medical advice is ethically and regulatorily unsound. It violates the principle of respecting the client's existing medical care and could lead to the client abandoning necessary conventional treatment, posing a significant risk of harm. This would be a failure to uphold professional integrity and potentially a breach of guidelines that expect practitioners to acknowledge and respect other healthcare providers. An approach that blindly endorses all holistic modalities without considering their potential interactions or contraindications with conventional medicine is also problematic. This could lead to unintended negative health consequences for the client, representing a failure to exercise due diligence and a potential violation of the duty of care. It also fails to acknowledge the scientific basis and evidence for certain conventional treatments. An approach that focuses solely on the holistic aspect without any consideration for the client's conventional medical diagnosis or treatment plan is negligent. It demonstrates a lack of comprehensive understanding of the client's health situation and could result in recommendations that are inappropriate or even harmful in the context of their existing medical condition. This would be a failure to integrate care and a disregard for the client's complete health picture. Professional reasoning. Professionals should adopt a client-centered, evidence-informed, and collaborative approach. This involves actively listening to the client's concerns and preferences, understanding their current conventional medical treatment, and then offering holistic recommendations that are complementary, safe, and do not contradict established medical protocols. When in doubt, or when there is a potential for conflict, open communication with the client, and with their consent, with their conventional medical provider is paramount. The decision-making process should always prioritize the client's safety and overall health outcomes. Question 11. Operational review demonstrates that a client presents with a specific, recurring physical discomfort and expresses a strong desire for immediate relief focused solely on that symptom. As a holistic health practitioner, HHP, which of the following approaches best aligns with holistic health principles and professional best practices? Option A. Focus exclusively on the client's stated symptom, recommending a series of isolated interventions aimed solely at alleviating that specific discomfort without exploring any broader contributing factors or the client's overall well-being. Option B. Acknowledge the client's discomfort, validate their desire for relief, and then initiate a comprehensive assessment to explore potential interconnected physical, emotional, and lifestyle factors that may be contributing to the symptom, collaboratively developing a plan that addresses both immediate relief and underlying causes. Option C. Immediately dismiss the client's stated symptom as a superficial concern and insist on a broad, unfocused exploration of their entire life history to identify potential issues without acknowledging their immediate discomfort. Option D. Without a thorough assessment, immediately recommend a specific advanced therapeutic technique that has shown some anecdotal success for similar symptoms, bypassing any discussion of underlying causes or the client's broader health picture. The correct answer is B. Acknowledge the client's discomfort, validate their desire for relief, and then initiate a comprehensive assessment to explore potential interconnected physical, emotional, and lifestyle factors that may be contributing to the symptom, collaboratively developing a plan that addresses both immediate relief and underlying causes. Explanation. 1. Scenario analysis. This scenario presents a professional challenge because it requires a holistic health practitioner, HHP, to balance the client's expressed desires with the practitioner's ethical obligations and scope of practice. The client's focus on a single symptom, while understandable, may not address the root causes of their discomfort, which is central to a holistic approach. The practitioner must navigate this by educating the client and guiding them towards a more comprehensive understanding of their well-being, without dismissing their immediate concerns. This requires strong communication skills, empathy, and a deep understanding of holistic health principles. 2. Correct approach analysis. The correct approach exemplifies best professional practice by prioritizing a comprehensive assessment that aligns with holistic health principles. It involves actively listening to the client's concerns, acknowledging their immediate discomfort, and then gently guiding the conversation towards exploring interconnected factors influencing their health. This approach respects the client's autonomy while upholding the HHP's responsibility to provide thorough and effective care. It demonstrates adherence to the ethical principle of beneficence, acting in the client's best interest, by seeking to address underlying causes rather than just superficial symptoms. Furthermore, it aligns with the core tenet of holistic health, which views the individual as a whole mind, body, and spirit, and recognizes that well-being is influenced by multiple interconnected factors. 3. Incorrect approaches analysis. An approach that immediately dismisses the client's stated concern and insists on a broad, unfocused exploration fails to acknowledge the client's immediate distress, potentially eroding trust and rapport. This could be seen as a failure to practice with empathy and could violate the ethical principle of non-maleficence by causing emotional discomfort. It also neglects the client's subjective experience, which is a crucial component of holistic assessment. An approach that solely focuses on the client's stated symptom without attempting to understand its broader context or potential contributing factors is a reductionist approach, contrary to holistic principles. This could lead to ineffective interventions that only provide temporary relief, failing to address the underlying imbalances. Ethically, this could be considered a failure to provide comprehensive care. An approach that immediately recommends specific, unproven interventions without a thorough assessment or client-centered discussion risks overstepping the HHP's scope of practice and could be considered unethical if it leads to harm or ineffective treatment. It bypasses the necessary steps of assessment and informed consent, which are fundamental to ethical practice. 4. Professional reasoning. Professionals should employ a client-centered, assessment-driven decision-making process. This involves 1. Active listening and empathy, fully understanding the client's stated concerns and validating their feelings. 2. Comprehensive assessment, utilizing a holistic framework to explore physical, mental, emotional, and environmental factors contributing to the client's well-being. 3. Collaborative goal setting, working with the client to establish realistic and mutually agreed-upon health goals. 4. Evidence-informed intervention, recommending strategies that are aligned with holistic principles and within the practitioner's scope of practice, with informed consent. 5. Ongoing evaluation, regularly assessing progress and adjusting the plan as needed. And 12. Compliance review shows a holistic health practitioner, HHP, is consulting with a client who has recently been diagnosed with a chronic autoimmune condition and is seeking guidance on how to manage their symptoms holistically. The client expresses concern about the side effects of their prescribed medication and is looking for natural alternatives. The HHP has extensive knowledge of nutrition, stress management techniques, and herbal remedies. How should the HHP best approach this situation to uphold the core philosophies of holistic health while adhering to professional and ethical standards? Option A. Provide the client with a comprehensive plan of natural remedies and alternative therapies that can replace their prescribed medication, assuring them that a holistic approach can cure their condition without the need for conventional medical intervention. Option B. Educate the client on the principles of holistic health, discuss lifestyle factors that can support overall well-being, and encourage open communication with their medical doctor regarding their treatment plan and any concerns about medication side effects, while also offering general information on stress reduction and nutrition that complements conventional care. Option C. Focus solely on stress management techniques and mindfulness, as these are universally beneficial and do not directly interfere with medical treatment, while avoiding any discussion of nutrition or herbal remedies to prevent potential conflicts. Option D. Recommend specific herbal supplements and dietary changes that have shown promise in managing autoimmune conditions, advising the client to gradually reduce their prescribed medication as they implement these natural alternatives. Correct answer is B. Educate the client on the principles of holistic health, discuss lifestyle factors that can support overall well-being, and encourage open communication with their medical doctor regarding their treatment plan and any concerns about medication side effects, while also offering general information on stress reduction and nutrition that complements conventional care. Explanation. Scenario analysis. This scenario presents a common challenge in holistic health practice where a practitioner must balance client autonomy and the desire to provide comprehensive care with the ethical imperative to operate within their scope of practice and avoid making unsubstantiated claims. The challenge lies in discerning when to offer support and education versus when to refer to other professionals, ensuring client safety and maintaining professional integrity. Correct approach analysis. The correct approach demonstrates an understanding of the core philosophies of holistic health, which emphasize the interconnectedness of mind, body, and spirit, and the client's inherent capacity for self-healing. It recognizes that while a holistic health practitioner, HHP, can provide education and support for lifestyle modifications that promote well-being, they are not licensed medical professionals and cannot diagnose or treat specific medical conditions. This approach prioritizes client empowerment by offering resources and encouraging collaboration with their primary healthcare provider, aligning with ethical guidelines that mandate operating within one's expertise and referring when necessary. This upholds the principle of do no harm by ensuring the client receives appropriate medical care for their diagnosed condition. Incorrect approaches analysis. One incorrect approach fails to acknowledge the limitations of the HHP's scope of practice. By suggesting direct intervention or treatment for a diagnosed medical condition, it oversteps professional boundaries and potentially misleads the client into believing the HHP can provide medical care, which is a violation of ethical practice and potentially regulatory guidelines concerning unlicensed practice. This approach neglects the fundamental holistic principle of integrating with conventional healthcare when appropriate. Another incorrect approach, while seemingly supportive, may still overstep by offering specific dietary or supplement recommendations without proper assessment or understanding of the client's medical history and current treatment plan. This can interfere with prescribed medical treatments and is outside the scope of practice for an HHP who is not a registered dietitian or pharmacist. It fails to recognize the importance of a multidisciplinary approach and the potential for adverse interactions. A third incorrect approach might involve dismissing the client's medical diagnosis or suggesting that holistic practices alone can cure serious conditions. This directly contradicts the holistic philosophy of integration and collaboration with conventional medicine. It is ethically unsound as it could lead a client to abandon or delay necessary medical treatment, posing a significant risk to their health and well-being. Professional reasoning. Professionals should approach such situations by first actively listening to the client's concerns and understanding their perspective. They should then assess the situation against their defined scope of practice and ethical guidelines. The decision-making process involves identifying the client's needs, determining what support the HHP can ethically and competently provide, and recognizing when referral to a qualified medical professional or other specialist is necessary. This ensures that the client receives comprehensive and appropriate care, fostering trust and promoting positive health outcomes. Question 13. Market research demonstrates a growing interest among clients in specific mindfulness techniques, such as advanced breathwork patterns and prolonged silent meditation, as popularized by various online influencers. A new client, who has recently experienced significant life stressors, approaches you, an HHP, expressing a strong desire to immediately engage in these advanced practices to manage their stress. What is the most appropriate course of action for the HHP? Option A. Conduct a thorough assessment of the client's current physical and mental health, discuss their specific stressors and goals, and then collaboratively determine if and how these advanced mindfulness techniques or modified versions are suitable and safe for them, providing clear guidance on practice. Option B. Advise the client that these advanced techniques are generally not recommended for individuals experiencing significant life stressors and suggest they seek guidance from a different type of practitioner. Option C. Share links to popular online resources and videos that demonstrate these advanced mindfulness techniques, encouraging the client to learn and practice independently. Option D. Immediately provide detailed instructions for the advanced breathwork patterns and prolonged silent meditation as requested, assuming the client's research has prepared them adequately for these practices. The correct answer is A. Conduct a thorough assessment of the client's current physical and mental health, discuss their specific stressors and goals, and then collaboratively determine if and how these advanced mindfulness techniques or modified versions are suitable and safe for them, providing clear guidance on practice. Explanation. Scenario analysis. This scenario presents a common implementation challenge for holistic health practitioners, HHP, where a client expresses a desire for specific mindfulness techniques without a clear understanding of their suitability or potential contraindications. The challenge lies in balancing client autonomy and express preferences with the HHP's professional responsibility to provide safe, effective, and evidence-informed guidance. HHPs must navigate the potential for misapplication of techniques, leading to unintended negative outcomes, while also respecting the client's engagement and motivation. The HHP's role is to educate and guide, not merely to fulfill requests without critical assessment. Correct approach analysis. The correct approach involves a thorough assessment of the client's current state, including their physical health, mental well-being, and any specific challenges they are facing. This assessment informs the selection and tailoring of mindfulness techniques. For instance, a client experiencing acute anxiety might benefit from simple grounding exercises and diaphragmatic breathing, whereas a client seeking stress reduction might be guided towards longer meditation sessions. The HHP must explain the rationale behind the chosen techniques, their expected benefits, and how to practice them safely and effectively. This aligns with the HHP's ethical obligation to provide competent care, ensuring that interventions are appropriate for the individual's need and circumstances. It also upholds the principle of informed consent, as the client is educated about the process and can make informed decisions about their participation. Regulatory frameworks for HHPs typically emphasize client-centered care, evidence-based practice, and the avoidance of harm, all of which are addressed by this comprehensive approach. Incorrect approaches analysis. One incorrect approach is to immediately provide detailed instructions for a complex meditation technique without understanding the client's background or current state. This fails to consider potential contraindications, such as if the client has a history of trauma that might be exacerbated by certain introspective practices, or if they have a medical condition that makes prolonged stillness difficult. This approach risks causing distress or harm, violating the HHP's duty of care, and potentially contravening regulations that mandate client safety and individualized care plans. Another incorrect approach is to dismiss the client's request outright, stating that the requested technique is not suitable without offering alternatives or explanation. This can disempower the client, damage the therapeutic relationship, and miss an opportunity to educate and guide them towards beneficial practices. It demonstrates a lack of empathy and a failure to engage in a collaborative therapeutic process, which is often a cornerstone of holistic health practice and may be implicitly or explicitly required by professional guidelines. A third incorrect approach is to provide generic, unverified information about mindfulness techniques found online or from non-professional sources. This bypasses the HHP's expertise and professional judgment, potentially leading the client to adopt ineffective or even harmful practices. It represents a failure to adhere to professional standards of practice, which require HHPs to rely on their training, knowledge, and ethical guidelines when recommending interventions. Professional reasoning. When faced with a client-specific request for a technique, a professional HHP should employ a decision-making process that prioritizes client safety and well-being. This involves 1. Active listening and inquiry. Understand the client's motivations and expectations behind their request. 2. Comprehensive assessment. Gather information about the client's physical, mental, and emotional state. 3. Evidence-informed guidance. Draw upon professional knowledge and evidence-based practices to determine the most appropriate techniques. 4. Collaborative planning. Discuss potential techniques with the client, explaining the rationale, benefits, and risks. 5. Tailored instruction. Provide clear, safe, and effective instructions, adapting them to the client's individual needs. 6. Ongoing monitoring and adjustment. Regularly assess the client's response to the techniques and make necessary modifications. This systematic approach ensures that the HHP acts within their scope of practice, upholds ethical principles, and provides the highest quality of care. Question 14. Quality control measures reveal that a holistic health practitioner, HHP, is developing a dietary plan for a client experiencing mild hypertension and seeking to improve overall well-being. The client expresses a strong interest in adopting a plant-based diet, citing anecdotal evidence of its benefits. The HHP has also reviewed research on the Mediterranean diet, which is known for its cardiovascular advantages. Which of the following approaches best reflects professional best practice for this HHP? Option A. Conduct a comprehensive nutritional assessment of the client, considering their current health status, lifestyle, and preferences, and then discuss the evidence-based benefits and potential considerations of both plant-based and Mediterranean dietary patterns, collaboratively developing a personalized plan that may incorporate elements of either or both. Option B. Immediately recommend a strictly vegan diet, emphasizing its purported ability to reverse hypertension and improve all aspects of well-being, based on the client's expressed interest and the anecdotal evidence they provided. Option C. Advise the client to follow a popular fad diet that promises rapid weight loss and detoxification, as this is often what clients seeking overall well-being are looking for, regardless of specific health conditions. Option D. Focus exclusively on the Mediterranean diet, as it is scientifically proven to benefit cardiovascular health, and dismiss the client's interest in a plant-based diet as potentially less effective or more complex to manage. The correct answer is A. Conduct a comprehensive nutritional assessment of the client, considering their current health status, lifestyle, and preferences, and then discuss the evidence-based benefits and potential considerations of both plant-based and Mediterranean dietary patterns, collaboratively developing a personalized plan that may incorporate elements of either or both. Explanation. This scenario presents a professional challenge because a holistic health practitioner, HHP, must navigate client-specific needs and preferences while adhering to evidence-based dietary recommendations and the ethical imperative to provide safe and effective guidance. The challenge lies in balancing the client's desire for a specific dietary pattern with the practitioner's responsibility to ensure the approach is nutritionally sound, appropriate for their health status, and aligns with the scope of practice for an HHP. Careful judgment is required to avoid making unsubstantiated claims or recommending diets that could be detrimental. The correct approach represents best professional practice because it prioritizes a personalized assessment of the client's health, lifestyle, and goals before recommending any dietary strategy. This aligns with the HHP's ethical duty to practice within their scope and to provide individualized care. By considering the Mediterranean diet's established benefits for cardiovascular health and its emphasis on whole foods, and the plant-based diet's potential for chronic disease management, the practitioner can then tailor recommendations based on the client's specific needs and potential contraindications. This evidence-informed, client-centered approach ensures safety and efficacy, upholding the professional standards expected of an HHP. An incorrect approach that focuses solely on promoting a fad diet without considering the client's individual health status or the scientific evidence behind the diet's claims represents a significant regulatory and ethical failure. This could lead to nutritional deficiencies, exacerbate existing health conditions, or create a false sense of security for the client, potentially delaying or interfering with necessary medical treatment. Recommending a diet that is overly restrictive or lacks essential nutrients without proper supplementation or monitoring would also be a failure, as it violates the principle of do no harm and the HHP's responsibility to provide safe and balanced nutritional advice. Furthermore, making definitive claims about disease prevention or cure through a specific diet, without robust scientific backing and within the scope of HHP practice, could be considered misleading and a violation of professional conduct guidelines. The professional decision-making process for similar situations should involve a thorough client intake, including a detailed health history, current dietary habits, lifestyle factors, and specific health goals. This should be followed by a critical evaluation of available evidence for various dietary approaches, considering their suitability for the individual client. The practitioner must then engage in shared decision-making with the client, explaining the potential benefits and risks of different options, and collaboratively developing a personalized plan. Continuous monitoring and adjustment of the plan based on the client's response and evolving needs are also crucial components of best practice. Question 15. System analysis indicates a holistic health practitioner, HHP, is consulting with a new client who has a diagnosed autoimmune condition and is currently taking prescription medication. The client expresses a strong desire to use a specific herbal supplement, which they have read about online, to manage their symptoms. The practitioner has no immediate knowledge of this particular herb's safety profile in relation to autoimmune conditions or its potential interactions with the client's prescribed medication. What is the most ethically sound and professionally responsible course of action for the HHP? Option A. Immediately provide the client with the herbal supplement as requested, assuming that if it is a natural remedy, it is inherently safe and will not interfere with their prescription medication. Option B. Politely decline to provide the herbal supplement and inform the client that you do not recommend its use without offering any further explanation or alternative suggestions. Option C. Recommend the herbal supplement based on general knowledge of its purported benefits for inflammation, without specifically researching its interactions with the client's autoimmune condition or current prescription medication. Option D. Conduct thorough research into the specific herbal supplement, focusing on its known effects, contraindications, potential interactions with the client's existing medical condition and medications, and then discuss the findings, including risks and benefits, with the client to collaboratively determine the best course of action. The correct answer is D. Conduct thorough research into the specific herbal supplement, focusing on its known effects, contraindications, potential interactions with the client's existing medical condition and medications, and then discuss the findings, including risks and benefits, with the client to collaboratively determine the best course of action. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a practitioner balancing a client's expressed desire for a specific herbal remedy with the practitioner's professional judgment regarding its safety and efficacy, especially when the client has a pre-existing medical condition. The challenge lies in respecting client autonomy while upholding the duty of care and adhering to ethical principles of herbal practice. The practitioner must navigate potential conflicts between client wishes and evidence-based recommendations, ensuring that the client's well-being remains paramount. Correct approach analysis. The correct approach represents best professional practice because it prioritizes client safety and informed consent. By thoroughly assessing the client's condition, researching the specific herb's contraindications and interactions with existing medications, and then engaging in a transparent discussion with the client about the risks and benefits, the practitioner demonstrates adherence to the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. This approach also respects client autonomy by providing them with the necessary information to make an informed decision, rather than simply dismissing their request or blindly complying. It aligns with the HHP certification's emphasis on evidence-informed practice and responsible client care. Incorrect approaches analysis. One incorrect approach involves immediately providing the requested herb without further investigation. This fails to uphold the duty of care, as it bypasses essential safety checks. It is ethically negligent because it disregards potential harm to the client, especially given their pre-existing condition and current medication. This approach violates the principle of non-maleficence. Another incorrect approach is to dismiss the client's request outright without explanation or offering alternatives. While it might stem from a concern for safety, it disrespects client autonomy and can damage the therapeutic relationship. Ethically, it fails to engage in a collaborative decision-making process and does not explore potential safe and effective alternatives that might still meet the client's underlying needs. A third incorrect approach is to recommend the herb based solely on anecdotal evidence or a vague belief in its general efficacy, without specific research into its interaction with the client's condition or medications. This is professionally irresponsible and ethically unsound, as it relies on insufficient evidence and potentially exposes the client to unknown risks, violating the principle of evidence-informed practice. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a comprehensive client assessment. This includes understanding their health history, current conditions, medications, and lifestyle. Following assessment, practitioners must engage in evidence-based research relevant to the client's specific situation, particularly concerning any proposed remedies. Open and honest communication with the client is crucial, involving a discussion of findings, potential risks, benefits, and alternatives. The final decision should be a collaborative one, empowering the client to make an informed choice while ensuring the practitioner has fulfilled their ethical obligations to provide safe and effective care. Question 16. Risk assessment procedures indicate that a client is interested in undertaking a 7-day liver cleanse diet which involves consuming only specific juices and herbal teas, claiming to remove toxins and reset their metabolism. As a holistic health practitioner, HHP, which of the following approaches best aligns with regulatory frameworks and ethical best practices for this situation? Option A. Conduct a thorough nutritional assessment of the client. Discuss the scientific evidence, or lack thereof, for the proposed cleanse, explain potential risks and benefits, and collaboratively develop a personalized, nutrient-dense dietary plan that supports natural detoxification pathways without extreme restriction. Option B. Provide the client with a generic 7-day juice and herbal tea regimen, as this is a common approach to detoxification and requires minimal individual assessment. Option C. Advise the client that all detoxification diets are unproven and potentially harmful, and refuse to discuss any dietary modifications related to their interest. Option D. Recommend the 7-day liver cleanse as requested by the client, assuming that if it is popular, it must be safe and effective for general use. The correct answer is A. Conduct a thorough nutritional assessment of the client, discuss the scientific evidence, or lack thereof, for the proposed cleanse, explain potential risks and benefits, and collaboratively develop a personalized, nutrient-dense dietary plan that supports natural detoxification pathways without extreme restriction. Explanation: this scenario is professionally challenging because it requires a holistic health practitioner, HHP, to navigate the complex and often unsubstantiated claims surrounding detoxification diets, balancing client desires with evidence-based practice and regulatory compliance. The HHP must critically evaluate the scientific validity of such diets, understand potential risks, and ensure their recommendations align with established health guidelines and ethical practice, avoiding the promotion of unproven or potentially harmful interventions. The correct approach represents best professional practice by prioritizing client safety and evidence-based recommendations. It involves a thorough assessment of the client's individual health status, medical history, and current nutritional intake. The HHP then educates the client on the scientific evidence, or lack thereof, supporting specific detoxification diets, discusses potential risks and benefits, and collaboratively develops a personalized, safe, and nutritionally sound dietary plan that may incorporate principles of whole foods and adequate hydration without resorting to extreme or unproven methods. This aligns with the ethical obligation to provide competent and responsible care, grounded in scientific understanding and client well-being, and avoids misrepresentation of services. An incorrect approach that involves recommending a specific, unproven detoxification, juice cleanse, without a comprehensive client assessment or scientific backing, represents a significant regulatory and ethical failure. This could be construed as practicing outside the scope of evidence-based holistic health, potentially misleading the client about the efficacy of the intervention, and failing to uphold the duty of care by not considering individual contraindications or nutritional deficiencies. Recommending a diet solely based on anecdotal evidence or popular trends, without critical evaluation, violates the principle of evidence-based practice and could lead to adverse health outcomes, exposing the practitioner to liability and disciplinary action. Another incorrect approach, such as dismissing the client's interest in detoxification entirely without exploration or education, fails to meet the client where they are and misses an opportunity for harm reduction and building trust, though it is less directly a regulatory failure than promoting unproven methods. The professional reasoning process for similar situations should involve a structured approach. 1. Client-centered assessment. Gather comprehensive health history, current diet, lifestyle, and client goals. 2. Evidence evaluation. Critically appraise the scientific literature regarding the client's interest, e.g., detoxification diets. 3. Risk-benefit analysis. Identify potential harms and benefits of proposed interventions, considering individual client factors. 4. Collaborative decision-making. Discuss findings with the client, providing clear, unbiased information and empowering them to make informed choices. 5. Personalized plan development. Create a safe, effective, and sustainable plan that aligns with evidence and client needs. 6. Ongoing monitoring and adjustment. Regularly review the plan's effectiveness and the client's well-being. Question 17. Governance review demonstrates that a holistic health practitioner, HHP, is consulting with a client who has a serious chronic condition and is currently undergoing conventional medical treatment. The client expresses a strong desire to incorporate a specific herbal remedy into their regimen, citing anecdotal evidence of its effectiveness. The HHP has limited knowledge of this particular herb and is concerned about potential interactions with the client's prescribed medications and the lack of robust scientific evidence supporting its efficacy for the stated condition. What is the most ethically and professionally responsible course of action for the HHP? Option A. Conduct thorough research into the herbal remedy's scientific evidence for efficacy, potential side effects, and interactions with the client's current medications, and then discuss the findings transparently with the client to collaboratively decide on the best course of action. Option B. Advise the client that herbal remedies are generally ineffective and potentially dangerous, and strongly discourage them from pursuing any such options, insisting they adhere solely to their conventional medical treatment. Option C. Immediately recommend the herbal remedy to the client, as their desire to explore natural options should be prioritized to maintain a positive therapeutic relationship. Option D. Agree to incorporate the herbal remedy into the client's plan without further investigation, assuming that natural remedies are inherently safe and beneficial, and to avoid upsetting the client. The correct answer is A. Conduct thorough research into the herbal remedy's scientific evidence for efficacy, potential side effects, and interactions with the client's current medications, and then discuss the findings transparently with the client to collaboratively decide on the best course of action. Explanation. Scenario analysis. This scenario presents a professional challenge where a holistic health practitioner, HHP, must balance client autonomy and the desire for natural remedies with the paramount responsibility of ensuring client safety and the efficacy of treatments. The HHP is faced with a client who is requesting a specific herbal remedy for a serious condition, but the practitioner has concerns about its scientific backing and potential interactions with prescribed conventional medication. This requires careful judgment to avoid harm while respecting the client's choices. Correct approach analysis. The correct approach involves a thorough, evidence-based assessment of the requested herbal remedy. This includes researching its known efficacy for the client's condition, potential side effects, and crucially, any contraindications or interactions with the client's current pharmaceutical treatments. The HHP must then engage in open, transparent communication with the client, presenting the findings clearly and objectively. This approach upholds the ethical principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. It also respects client autonomy by providing them with accurate information to make an informed decision, rather than dismissing their request outright or blindly agreeing to it. Adherence to professional standards for HHPs, which emphasize evidence-informed practice and client safety, is central here. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the client's request for the herbal remedy without any investigation. This fails to respect client autonomy and can damage the therapeutic relationship. It also neglects the possibility that some herbal remedies may have legitimate, albeit perhaps complementary, benefits. Ethically, it can be seen as paternalistic. Another incorrect approach is to agree to the herbal remedy without due diligence, simply to appease the client. This is a grave ethical failure, as it prioritizes client satisfaction over safety and well-being, potentially leading to adverse drug interactions or ineffective treatment. This directly violates the principle of non-maleficence and professional responsibility to provide evidence-informed care. A third incorrect approach is to recommend the herbal remedy without disclosing potential risks or interactions, or without verifying its safety and efficacy. This constitutes a failure in informed consent and professional negligence. The HHP has a duty to disclose all relevant information, both positive and negative, to enable the client to make a truly informed choice. Professional reasoning. When faced with a client request for a specific treatment, especially one involving complementary or alternative modalities like herbal remedies, a professional decision-making process should involve 1. Active listening and understanding. Fully comprehend the client's request, their motivations, and their understanding of the proposed treatment. 2. Evidence-based research. Conduct thorough research into the safety, efficacy, and potential interactions of the requested remedy, utilizing reputable scientific literature and professional databases. 3. Risk-benefit analysis. Objectively evaluate the potential benefits against the known risks for the individual client, considering their specific health status and current medical regimen. 4. Transparent communication. Engage in an open and honest dialogue with the client, presenting all findings including uncertainties, potential side effects, and interactions. 5. Collaborative decision-making. Empower the client to make an informed decision in partnership with the practitioner, respecting their autonomy while guiding them towards the safest and most effective course of action. 6. Documentation. Meticulously document the entire process, including the research conducted, the discussions held with the client, and the final agreed-upon plan. Question 18. Stakeholder feedback indicates that clients are increasingly seeking to use herbal supplements alongside their prescribed pharmaceutical medications. A client reports taking a blood-thinning medication and expresses interest in a popular herbal supplement known for its potential anti-inflammatory properties. What is the most responsible and ethically sound course of action for the holistic health practitioner, HHP, in this situation? Option A. Inform the client about the potential for interactions and strongly recommend that they consult with their prescribing physician or a qualified pharmacist before proceeding with the herbal supplement. Option B. Immediately advise the client to discontinue their prescribed medication and switch to the herbal supplement, as it is a natural alternative. Option C. Proceed with recommending the herbal supplement, assuming that natural remedies are always safe and do not interact with pharmaceuticals. Option D. Research the herbal supplement's properties and potential interactions with blood thinners, and then recommend it to the client if no significant contraindications are found in general literature. Correct answer is B. Immediately advise the client to discontinue their prescribed medication and switch to the herbal supplement, as it is a natural alternative. Explanation. This scenario is professionally challenging because it requires the holistic health practitioner, HHP, to navigate the complex and potentially dangerous interactions between herbal supplements and prescribed pharmaceuticals. The HHP has a duty of care to their client, which includes ensuring their safety and well-being. This necessitates a thorough understanding of both conventional medicine and complementary therapies, as well as the legal and ethical obligations to consult with the client's primary healthcare provider when potential conflicts arise. The correct approach represents best professional practice because it prioritizes client safety and adheres to the principle of informed consent and collaborative care. By consulting with the client's physician, the HHP demonstrates a commitment to evidence-based practice and recognizes the limitations of their scope of practice. This collaborative step ensures that any recommendations regarding herbal supplements are made with full awareness of the client's existing medical conditions and pharmaceutical regimen, thereby minimizing the risk of adverse drug-herb interactions. This aligns with the ethical imperative to do no harm and the regulatory expectation for HHPs to operate within their competency and collaborate with other healthcare professionals. An incorrect approach that involves recommending herbal supplements without consulting the client's physician fails to uphold the HHP's duty of care. This constitutes a significant ethical failure, as it bypasses a crucial safety check and could lead to serious adverse events, including reduced efficacy of prescribed medications, increased toxicity, or new health complications. From a regulatory standpoint, this action could be considered practicing outside the scope of practice, especially if the HHP does not possess the specific expertise to accurately predict and manage complex drug-herb interactions. Another incorrect approach, such as dismissing the client's concerns about potential interactions and proceeding with herbal recommendations without further investigation, is also professionally unacceptable. This demonstrates a lack of due diligence and a disregard for client autonomy and safety. Ethically, it violates the principle of beneficence by not acting in the client's best interest. The professional decision-making process for similar situations should involve a systematic approach. 1. Information gathering. Obtain a comprehensive list of all current pharmaceutical medications, dosages, and the reasons for their prescription from the client. 2. Client education. Discuss the importance of potential interactions between herbs and pharmaceuticals with the client, emphasizing the need for caution and professional consultation. 3. Research and consultation. Thoroughly research known or potential interactions between the specific herbs the client is interested in and their prescribed medications. Crucially, consult with the client's prescribing physician or a qualified pharmacist to verify information and discuss potential risks and benefits. 4. Informed recommendation. Based on the gathered information and professional consultations, provide an informed recommendation to the client, clearly outlining any identified risks and the rationale behind the advice. 5. Documentation. Maintain detailed records of all consultations, research, and recommendations provided to the client. Question 19. The control framework reveals that when a client expresses a desire to manage stress more effectively, but shows hesitation when mindfulness techniques are suggested as a potential tool, what is the most ethically sound and professionally appropriate course of action for a holistic health practitioner, HHP? Option A. Gently explain the potential benefits of mindfulness in managing stress. Answer any questions the client may have, and respect their decision if they still prefer not to explore it at this time. Option B. Insist that the client try mindfulness techniques, emphasizing that it is a highly effective method for stress management and that their hesitation is likely a barrier to progress. Option C. Completely avoid mentioning mindfulness again, focusing only on other stress management strategies the client seems more receptive to, even if mindfulness could be highly beneficial. Option D. Suggest that the client's hesitation indicates a deeper psychological issue that the HHP is not equipped to handle, and refer them to a different type of practitioner immediately. The correct answer is A. Gently explain the potential benefits of mindfulness in managing stress, answer any questions the client may have, and respect their decision if they still prefer not to explore it at this time. Explanation. The control framework reveals that a holistic health practitioner, HHP, must integrate principles of mindfulness into their practice ethically and effectively. This scenario is professionally challenging because it requires balancing client autonomy with the practitioner's professional judgment and scope of practice, all while adhering to the specific regulatory framework governing HHPs. The core of the challenge lies in discerning when to gently guide a client towards mindfulness practices and when to respect their resistance, ensuring that the guidance is supportive rather than prescriptive, and that it remains within the HHP's defined competencies. The correct approach represents best professional practice because it prioritizes client-centered care and informed consent. By explaining the potential benefits of mindfulness in a non-coercive manner and respecting the client's decision, the HHP upholds ethical principles of autonomy and beneficence. This aligns with the regulatory framework's emphasis on client empowerment and the practitioner's responsibility to operate within their scope, ensuring that interventions are relevant and beneficial without overstepping boundaries. The HHP acts as a facilitator of well-being, not an enforcer of specific practices. An incorrect approach that involves insisting the client try mindfulness, despite their expressed hesitation, represents a failure to respect client autonomy. This could be interpreted as a breach of ethical guidelines that mandate informed consent and the right to refuse treatment or guidance. It also risks alienating the client and damaging the therapeutic relationship, potentially leading to a negative outcome. Furthermore, it could be seen as practicing outside the scope of what is ethically permissible for an HHP if the insistence becomes overly directive or implies a level of therapeutic necessity that is not clinically established for that individual. Another incorrect approach, that of completely disregarding the potential benefits of mindfulness and not mentioning it at all, even when relevant to the client's stated goals, fails to uphold the principle of beneficence. Respecting client autonomy is crucial. An HHP also has a professional responsibility to offer evidence-informed guidance that could support the client's well-being. Failing to do so, when appropriate, could be seen as a missed opportunity to provide valuable support, potentially hindering the client's progress. This could also be viewed as a lack of professional diligence in exploring all avenues of support within the HHP's purview. The professional decision-making process for similar situations should involve a continuous assessment of the client's needs, goals, and comfort level. Professionals should first clearly understand the client's presenting issues and stated objectives. Then, they should consider how their scope of practice and the principles of mindfulness might be relevant and beneficial. When introducing any new concept or practice, it should be done with clear, non-judgmental communication, explaining potential benefits, and allowing the client ample opportunity to ask questions and express concerns. The practitioner must be prepared to accept the client's decision without pressure, always prioritizing the client's autonomy and the integrity of the therapeutic relationship. This iterative process ensures that interventions are both ethically sound and maximally beneficial. Question 20. Assessment of how a holistic health practitioner, HHP, should interpret and apply the definition of holistic health when a client presents with complex physical symptoms alongside significant emotional distress, considering the HHP's scope of practice. Option A. The HHP should attempt to address both the physical symptoms and the emotional distress using a broad range of holistic techniques, assuming that all aspects of health fall under their purview as a holistic practitioner. Option B. The HHP should integrate their understanding of mind-body connection and refer the client to a licensed mental health professional for the emotional distress, while continuing to support the client's physical well-being through appropriate holistic modalities within their scope. Option C. The HHP should prioritize addressing the emotional distress exclusively, as it is often the root cause of physical ailments, and defer any physical symptom management until the emotional issues are resolved. Option D. The HHP should focus solely on the physical symptoms, as this is the most tangible aspect of health, and advise the client to seek separate help for their emotional distress without further engagement. The correct answer is B. The HHP should integrate their understanding of mind-body connection and refer the client to a licensed mental health professional for the emotional distress, while continuing to support the client's physical well-being through appropriate holistic modalities within their scope. Explanation. The scenario presents a challenge for a holistic health practitioner, HHP, in defining the scope of their practice, particularly when encountering client needs that extend beyond their direct expertise. The core difficulty lies in balancing the holistic philosophy of addressing the whole person with the ethical and regulatory imperative to practice within one's competence and refer when necessary. A HHP must understand that holistic health encompasses physical, mental, emotional, social, and spiritual well-being, but their role is to facilitate client empowerment and well-being within their defined scope, not to act as a medical doctor, therapist, or other licensed professional without appropriate credentials. The correct approach represents best professional practice because it adheres to the foundational principles of holistic health while respecting professional boundaries and regulatory frameworks. It acknowledges the interconnectedness of various aspects of health as central to the holistic model, but crucially, it prioritizes client safety and efficacy by recognizing the limits of the HHP scope. This involves understanding when to integrate complementary approaches and when to refer to other qualified professionals, ensuring the client receives comprehensive and appropriate care. This aligns with ethical guidelines that mandate practitioners to act in the best interest of the client and to practice within their defined competencies. An incorrect approach that oversteps the HHP scope by offering advice or interventions for conditions requiring licensed medical or psychological expertise is a significant regulatory and ethical failure. This could constitute the unlicensed practice of medicine or therapy, which is illegal and harmful. It violates the principle of do no harm by potentially delaying or interfering with necessary medical treatment. Another incorrect approach that narrowly defines holistic health solely within the physical realm neglects the core tenet of the holistic model, which is the integration of mind, body, and spirit. This failure to embrace the full scope of holistic principles limits the practitioner's ability to effectively support the client's overall well-being and may lead to superficial or incomplete interventions. A third incorrect approach that focuses exclusively on spiritual well-being without considering other dimensions of health also fails to embody the holistic philosophy and could neglect critical physical or emotional needs. The professional decision-making process for similar situations should begin with a thorough assessment of the client's stated needs and concerns. The HHP must then evaluate these needs against their own training, expertise, and the established scope of practice for HHPs. If the client's needs fall within the HHP scope, the practitioner can proceed with appropriate holistic modalities. If the needs extend beyond their scope, the professional and ethical obligation is to clearly communicate this to the client and provide appropriate referrals to licensed professionals who can address those specific needs, while still maintaining a supportive and integrated approach to the client's overall well-being.